Good evening, everybody. I'm Sayukta from Bladder Wellness Team. I'm sure all of you must be keeping good health. Please vaccinate yourself and do wear mask when at public places. OAB, or an overactive bladder, is a frequent and sudden urge to urinate that may be difficult to control. The condition is quite common and distressing and may have a large impact on the quality of life. Let's unite to raise awareness about incontinence related issues and its impact in the life of people living with it. To throw more light on the subject and guide us on what's right for diagnosis and treatment of an overactive bladder, today we have with us renowned Dr. Charan Kanwal Singh. Dr. Charan Kanwal Singh is Senior Consultant Urologist from RG Stone Super Speciality Hospital, Ludhiana. Dr. Singh is having rich experience in the field of urology and carries out the treatments with utmost precision and efficiency, ensuring that the patient's health is in safe hands. A very warm welcome to you, Dr. Singh. It's a pleasure to have you with us for this session.
Yeah, good evening. Thanks for the one kind introduction.
Uh, yes. So, Dr. Singh, today we are going to talk about overactive bladder. Now, before we proceed, first of all, I would like to ask you what we actually mean when we say overactive bladder. What's an OAB?
So basically, an overactive bladder is not just a single symptom. It is basically syndrome consisting of multiple symptoms, which when combined together amounts to the overactive bladder. It is basically urinary. In it, what happens is urinary urgency, which may or may not be associated with the incontinence, which is associated with the increased daytime frequency and also increased nighttime frequency. And all of these symptoms should be there, and we have to rule out there is no any associated infection or no any associated obvious pathology like cancer or stones or anything like that. If all these things are ruled out and all these symptoms are present, it is an overactive bladder. So it is basically a group of symptoms without any associated particular pathology because of which this particular symptom can happen.
Okay.
Breaking on to the definition, there are various parts in the definition. First is the urgency, second is the increased frequency, third is the nocturia part, fourth is the that incontinence, which may be associated with the urgency part. So these are four particular things which are there in the definition.
Okay,
Yeah.
so now at least we understand, Dr. Singh, that what is an overactive bladder and what are the
Yeah.
major symptoms. Now we would like to understand why this happens. What are the causes which are responsible for an overactive bladder?
Basically, the main cause for this overactive bladder, after we rule out all the causes which can cause increase in the frequency and the urgency, which we commonly know like the infection or some stone disease or some like pathology associated with the mucosa, like a bladder carcinoma and all. We have to rule out all of these, and afterwards, if the symptoms still persist, we can label it as an overactive bladder. So the mechanism behind it, the control of the nerves of the bladder is via the brain, via the central nervous system. So there is a particular in the neural pathway, there is some abnormalities there because of which the signaling, continuous signals are coming from the brain to pass the urine, which in fact should, in the resting state, the brain should send the inhibitory signals, but it is not sending the inhibitory signals. So we are having a constant urge to pass the urine. If we don't pass urine, we may start feeling uneasiness. The patients like which most commonly come to our OPD and say that whenever I have to go to pass urine, I have to go, I can't hold. And whenever I want to go, I have to rush because if I don't rush, I will have some anxiety and all the things. These are all the things which, and also apart from this neural mechanism, some myogenic phenomena is also there. The muscle of the bladder is the detrusor muscle. So basically there is some irritation in the urothelium and the detrusor muscle because of which overactivity of the detrusor muscle happens, and because of which there is increased frequency and urgency and nocturia.
Right. Now, doctor, as per the
The main point in it was that at the for diagnosing the overactive bladder, we have to rule out a multiple set of things. Rather than for the making a diagnosis, we have to, for the common diseases, we do a test and diagnose things. But for labeling overactive bladder, we have to do the test and rule out things. That is the main point in it.
Right. We completely got your point. So to rule out the other, whether some underlying health conditions are there, like you said,
Yeah,
some infection or cancer, etc. Then, if nothing is
yeah,
there, then it's we can term it as
yeah,
OAP. Another
yeah,
thing is that all the symptoms that we just what we have just discussed are also very common in
mm,
the people who are aging, very common with especially
yeah.
men because they have prostate issue after a certain age. Now
So
they do have these symptoms and they often say that, see, I'm aging, I'm bound to have this, or see, I'm a man, I have all prostate
yeah,
enlargement issues, so I'm bound to
yeah,
have this, so I have to live with it. What's
yeah.
your take on that?
So basically, first we have covered the pathology part. Now coming on to the etiology part. Aging is a aging is associated. It is the higher the age group, higher is the prevalence of the overactive bladder, and mainly among the female patients after the menopausal age group. There is a local estrogen deficiency as the woman progresses to a menopausal age group. There are some hormonal deficiencies are there, because of which this can happen. Along with that, some other issues which are associated with the overactive bladder are like if the patient is having some bowel issues, like he is having a frequent constipation, he is going to pass stools less than 3 times a week. So these patients are more prone to overactive bladder. And also patients with some neurological diseases like having a past history of stroke, having any history of dementia, also the patients having any metabolic syndromes, that patients are more prone for the overactive bladder syndromes. Yeah.
Right. Right,
And
doctor.
And
And
also
if
in this
yes,
overactive
yes.
bladder, one part is here, it can be a dry overactive bladder or it can be a wet overactive bladder.
Okay.
Wet overactive bladder is in which there is incontinence associated with urgency. And this wet overactive bladder is more prevalent in females because of the weaker sphincter mechanism, because of the childbirth and the shorter length of the urethra. So
Mhm.
women are more prone for the wet overactive bladder and males are for a dry overactive bladder. And like you said, the cause of the prostate, that after prostate surgery, the patients still have the symptoms of increased frequency and urgency. It can happen if they delay the treatment of a prostate for a prolonged period of time, because of which, as already told, some myogenic theory is there for it. Some damage to the muscle occurs, which becomes permanent. So even after the treatment of a prostate gland, even if he has got surgery for the prostate gland, he still may have symptoms for these overactive bladder, like increased frequency and urgency.
Right. Dr. Singh, as you said that in women, as their urethra is shorter, or after giving birth to a child due to the weakened, pelvic floor, etc., they have
Yeah.
this tendency of incontinence,
Yes.
and thus,
Yes.
as you said, that women are more prone to wet OAP.
Yes.
Now,
Yes.
can
Yes.
you elaborate it more and how? Because women are so hesitant to come up and share their
Yeah.
problem with the doctor, etc. So how
Yeah.
we should address that?
So basically, it affects the quality of life of the patients, especially in the wet category. The patients which are frequently wet, they will have some social issues, anxiety issues. They will have fear of going out, meeting people, that if their clothes are soiled, it will smell and all. And in most of the studies, what happens is we have seen that the female patients are more prone for wet overactive bladder. But at the same time, they report less to the clinicians because of the social stigma part, less awareness part, which
Yeah,
we are trying to create awareness through this our wonderful program on bladder wellness, that
exactly.
patients should be aware of these things, that these things happen with the age, happen after some problem like after some neurological issues, after childbirth and all. And females also need to be aware of these things, that these things are treatable. These are not tested, it is a part of aging. It is not like that. It is treatable. For this, awareness is needed. And it also overactive bladder, which in another part of the world is social stigma is there, that we can't don't discuss the sexual issues with the patients. So basically, in the patients which keep on wet because of the overactive bladder, especially the female patients, so it affects their sexual life also, because of which ultimately the quality of life suffers. So we need to aware the general population, especially the females, of this part, that it is treatable.
Right. So the good news is it's treatable. And that's the
Yeah,
whole purpose of having this session, that we can
yeah,
aware our viewers, both male and female, that see if you have these syndromes, these symptoms, please go and check with a doctor, check with a urologist or an urogynecologist, so that, you can just find out what is the root cause. B, you
mm,
can get treated and get relieved
yeah,
and have a good quality of life and health.
yes,
Doctor, you said it's treatable. That's a good news
yeah.
for all of us. But then we would
Yes.
like to know what are the treatment options available.
So coming on to the management part, whenever a patient comes to us with this type of symptoms, a group of symptoms, we need to take a proper history of the patient followed by examination part. In history, we need to ask some specific questions that why he is not able to hold the urine. What happens when if he holds? If there is some associated pain part, if he starts feeling pain when he holds a urine, then it completely changes the line of treatment. It comes to the interstitial cystitis part. If there is no pain and still he is feeling anxious, he's not able to hold the urine, then we may come to the direction that it may be a simple overactive bladder. And we need to rule out urinary tract infection by urine complete examination test. We may need to do a ultrasonography to look for any cystitis part, any infection in the kidneys part, and some other investigations in the form of cystoscopy and urodynamic study, which are needed in the later part of the treatment if the patient doesn't improve with the our simple pharmacotherapy and behavioral treatment. And also, we may need to, some patients have some occult neurological disease, which is not diagnosed as such, and patient presents with these group of symptoms. And when we just investigate the patient, then we find out that there is some neurological issues there, which is affecting this part. And also in the history part, some spine problems we may need to rule out because of the spinal nerves which are coming via the spinal cord, if there is any injury has happened to it or not. We need to rule out that also. So in the history and examination investigation part, this is now coming on to the treatment part. The treatment basically it is divided into various subcategories. First and foremost is a behavioral therapy. So in behavioral therapy, there are lifestyle modifications are there. So we need to educate the patient. Along with that, we tell the patient to maintain a bladder diary. So what we educate the patient is that what is the diseases, what is this disease, how it will be treated, how it will be cured. Because this disease is not like that we are having a fever, we will take paracetamol 650, fever will go away. The treatment is not like that in overactive bladder. It is a complex treatment. A proper counseling of the patient, proper motivation of the patient, it is the must in this because the treatment will take days, weeks, months, years. It will take, and patient have to continuously take the treatment, and which can be a simple, just a lifestyle modification only. So the patient should also understand that what he should expect from us. There should be some realistic expectations. It is not like that we have started the treatment. After 2 days, patient will be completely fine. It is not like that. And in the lifestyle modifications, some fluid management part is there. We tell the patient to drink as much water is required, not too much quantity of water, not too little water. So in simple saying, it is 30 ml per kg per day is the adequate amount of water, which in a 60 kgs male or female comes to approximately 1.8 to 2 liters per day. So it is the adequate amount of water which a person needs to take. And also we can consult the patient around the about the quantity of water he is consuming. The urine should be light yellow in color. If it is just pure crystal clear, then he's taking too much of water. That's why he is having these symptoms. If he will restrict the amount of water to just 2 to 2.5 liters, his symptoms will resolve without any pharmacotherapy.
Okay.
Apart from this, we also advise the patient to limit the caffeine intake, like tea, coffee, because caffeine just caffeine acts as a diuretic, which causes increase in the daytime frequency and also the nocturia. Our guidelines also recommend the patient to completely stop the caffeine intake. Not just he is taking a tea 3 times a day. We will tell him take it 1 time a day. Caffeine needs to be stopped completely. Along with the beverages like we know some soft drinks which contain caffeine and all. Alcohol also needs to be stopped. And also some spicy foods and citrus fruits needs to be stopped because they act as a direct irritant to the urothelium, which leads to these symptoms. Along with that, in the behavioral therapy, there are the patient should have a healthy bowel habits. He shouldn't be constipated. He should pass at least motion once a day. So if we promote the bowel regularity, it will ultimately improve the overactive bladder symptoms. If the patient is overweight, we tell him to reduce the weight. These are the basically lifestyle modifications which we tell to the patient to improve the symptoms. Apart from that, there are some pelvic floor muscle exercises are there which we tell the patient to do. In it, it is a type of Kegel exercises are there in which we counsel the patient to contract the muscles, the urinary muscles, to contract the muscles for a particular period of time, 2 to 5 seconds, and then to relax these muscles. So he has to do this exercise in a group of 3 to 4 sets around 5 to 10 times a day. These are very helpful to the patients which can do them regular. And we counsel the patient, we tell the patient that we tell the patient how to control these symptoms. We will tell him whenever he feels the urge to pass the urine, just wait for a few minutes. Let the urgency grow. You have a self-control in yourself. Just wait. And then a time will come when the more urgency will stop and it will be at the peak level. So at that time, we tell the patient to think of something else, like he is the boss, not the bladder. He can control the bladder. So in this way, we self-motivate the patient. Because of this self-motivation, the patient improves. And we tell the patient to increase the time, like if he is voiding every 30 to 45 minutes. We tell him, you start at 45 minutes, go to 55 minutes, increase 10 minutes per void. Try to increase at least 10 minutes. If he's able to increase 10 minutes, next step is we tell him to increase 20 minutes. So in this way, patient regains the self-control, has less of anxiety, is able to control the symptoms. If this lifestyle modifications are not able to control the symptoms and also the pelvic exercises are not much helpful, then we may need to start the pharmacotherapy to the patient. And in it, there are particular type of drugs are there which are sort of have been advanced from time to time. Now the latest are one is solifenacin and the mirabegron. And both are a wonderful drugs. They help the patient and they help the patient to control the symptoms of this overactivity.
Yeah. So we have lifestyle modification, then we have medication, etc. Now, with what you said, doctor, I can make out the lifestyle modification as one of the most important thing. And if that works, nothing like that. But for that, do the patient?
That's why I've spoken a lot on lifestyle modification and less amount on pharmacotherapy.
Yes, I completely got that. And does this make that the patients should actually not ignore these symptoms or not waste time and just waiting and suffering in silence and come up and reach to the doctor as soon as possible because of the lifestyle modification works? Then of course they'll get the relief early.
Yeah, so that's what I would call. There's a lot of a social stigma is there. The patients keep on delaying, it will ultimately affect their quality of life. They will have anxiety issues. Sometimes if a patient is having too much of nocturia, he will be not be able to sleep in the night. So daytime sleepiness will be there. It will ultimately hamper his work at the workplace. So these all things are associated with it. It is not just he has to wake up in the night to pass the urine, but it ultimately affects his quality of life. It is already told it ultimately affects the sexual life of the female patients, which is mainly ignored in our part of the country. It is ignored, but it is a very important issue which we need to address.
Exactly. Now, doctor, one more thing. for example, if a patient is having these symptoms, maybe he or she was not aware that there's a term called OAB, and it's a syndrome, and these symptoms come under this umbrella term. Now, the thing is, now after watching this session, if he or she understands that, okay, so I have these symptoms, what he or she should do?
He should visit a specialist, mainly a urologist, so that he can discuss all the problems he is having, all the issues which he is having with the urination. He has to go to pass urine again and again, which is hampering his quality of life. He should consult a urologist. He or she should consult a urologist. Rather than going to some quack or anyone, he should consult a doctor. Not that some of my friend is taking this tablet and he has improved. Not like that. Not going to a pharmacy and taking the medicine from a pharmacy without knowing what is disease process is happening. As I already told you, it can be some occult neurological disease also,
Right.
because of which these symptoms are happening. There can be some underlying malignancy also, because of these which symptoms are happening.
Right.
So he should consult a specialist.
So please don't waste your time. Go and consult a urologist if you have these symptoms. It's important to go to the root cause. It's important to diagnose the cause. It's important to rule out other medical conditions. That's really important. Doctor, now you said that, nocturia is one thing, waking up at night to void oneself. Then people have this urgency, frequency, etc. Now, my question is that in general, people are not aware that what should be the time when I should go and void myself. How many times in a day, how many times a night is normal?
That is an important question. So as per our guidelines, there is a no fixed daytime frequency which a person should go and pass the urine. Okay. But a healthy person passes urine at least 5 to 6 times a day. And we tell our patients to go to washroom every at least 3 hours to pass the urine, even if he is not having any urge to pass the urine, to maintain a healthy bladder and healthy lifestyle. And in the night time, if the person is voiding more than he's waking up more than once per night, it is abnormal. So the time we go to bed until we wake up, in between, if we have to wake up more than once at night, then it is abnormal. So less than one time nocturia is normal. More than once, it is abnormal. It can lead to just the patient will not be able to sleep properly. And also in the elderly age group, he may have falls in the frail elderly people. Like he is waking again and again at night. He may have fall, he may have fractures.
Right.
So that point we need to see.
Exactly.
More than once is abnormal. Yeah. If a person is already elderly lady, she's waking again and again at night. She is in her sleep only. She is going to washroom. She can fall. And in the elderly people, fractures are more common than the young people.
Right.
So this just overactive bladder can lead down to a disastrous things.
Right, it can have other, dangerous or harmful things associated to it. Doctor, one more thing. In our urinary system, apart from the bladder, there are few more organs associated with it, like the kidney, which works as the filter. In men, we can talk about prostate as the path of urine, go through that. Now, my question is, if I keep on ignoring the symptoms of OAB, is there a possibility that my other organs associated with the urinary system will also get affected?
Yeah, definitely. If we keep on ignoring the symptoms, later on, there can be some permanent changes to the muscle of the bladder, because of which urine, instead of coming outside from the urethra, it will act as a back pressure changes to the kidneys, which can cause swelling, which we say hydronephrosis in the kidneys, which can ultimately lead on to the decrease in the renal function, which will amount as a rise in the creatinine levels. So once a time will come and the creatinine will be too much and there will be no urine production from the kidneys. If we keep on ignoring for a long time, it can have a disastrous complications like a permanent kidney failure, which we say as a CKD, chronic kidney disease.
So now we understand, it's just not our quality of life that's hampering due to these symptoms. It's also, of course, underlining, medical condition would be there, a
Yeah,
malignancy or other
yeah,
infection, etc. Plus, there are other dangers as well. So please, again,
yeah,
don't suffer in silence. Go and contact your doctor before
yeah,
it's too late. Doctor, we will
yes,
also take some of our viewers' questions. We have
yeah, sure.
Narendra Singh. He's asking, though we have discussed it, but maybe he joined us a little later. So his question is, are there exercises that can strengthen pelvic floor muscles to help
So
with the...
Can you please repeat? Sorry.
Yes,
Yeah,
sure.
yeah.
Narendra is asking, are there exercises that can strengthen pelvic floor muscles to help with incontinence?
Yeah, already told there are the
Yes.
exercises which I told that Kegel exercises are there.
Mhm.
There are type of pelvic floor muscle exercises in which we advise the patient to contract the pelvic floor muscles. The most easiest way is to we contract the muscle while we are holding the urine. If we are not able to go, we hold the urine. So we tell the patient to do these exercises. He has to contract the muscles for 5 seconds, then relax the muscle for 5 seconds. This 5 second total 10 sets are done 4 times a day. So you have to contract the muscle for 5 seconds, then relax the muscle for 5 seconds. Then again repeat this 9 times more at a one time in the morning. Then again in the afternoon, again in the evening, again in the night. The You can do it in the either in the sitting posture or in the lying down or in the standing position. And also prior to doing these exercises, the bladder should be empty. So as already told, these exercises are very helpful in the female patients. These help to regain the pelvic floor muscle tone, which is weakened after a childbirth.
So we
Yeah.
have Kegel exercises to strengthen our pelvic floor. Doctor, you said that UTI can cause these symptoms, which OAB also have. Now, Deepak is asking, Deepak Upadhyay, does OAB lead to UTI?
No, OAB doesn't lead to UTI. UTI is OAB in the definition of OAB is already I've told it is there. If there is no infection or associated pathology, only then we label it as a OAB. So some of the symptoms overlap between UTI and the OAB. But for diagnosing OAB, we need to rule out a UTI, which we do by doing a complete urine examination and also ultrasonography. Yeah.
Okay. We have Sabri Nathan asking, can pregnancy lead to OAB? I think she wants to ask because, during pregnancy, urgency, frequency, incontinence, these things again takes place.
So these symptoms can be there in pregnancy because of the hormonal changes, the increase in the uterus size, which presses the bladder, because of which increased frequency and urgency can occur. But it is not overactive bladder. It's already told it is a wonderful definition which has been given by us, our International Continence Society, ICS, that there should be no any associated pathology or process. So pregnancy is not a pathology, but pregnancy is causing these changes because of the hormonal changes, because of the pressure on the uterus. It is not OAB.
Okay.
We may do all these things like lifestyle modification, pharmacotherapy to control the symptoms which are happening, but it is not OAB.
Right. And doctor, during pregnancy, UTI again is very common. So in case a lady is going through pregnancy and have these symptoms, is it required for her to go and have a check with the doctor?
Yeah. Even if a pregnant lady is having these symptoms, or even if she's not having these symptoms, a urine culture in the first trimester is mandatory. Not just a simple urine routine or complete urine examination. Urine culture is mandatory as per the guidelines, because a urine routine can sometimes miss the infection. The urine culture will demonstrate the bacteria which is there in the urine, and it needs to be treated. Even if it is asymptomatic, it needs to be treated. And we have to diagnose it by urine culture only.
Right. Neha Mishra is asking, how do we diagnose incontinence or OAB?
Incontinence, there is nothing as special to diagnose incontinence. It is a wetting of the clothes. If the patient is wetting the clothes, it is incontinence.
Leaking
Whether it is,
in simple
yeah,
words, we
it
can
is,
say.
in simple words, it is, if he is leaking, it is incontinence, then we may need to look on the causes, that what is causing incontinence. There are various causes for the incontinence. One is the urgency, which is a part of this overactive bladder. Sometimes there can be stress urinary incontinence, in which the patient coughs, sneezes, or suddenly just stands up from a chair. He leaks some amount of urine. It is stress urinary incontinence. And in some cases, he leaks during stress also and during urgency also. It is mixed urinary incontinence. And in some of the patients, they are just sitting and the urine is leaking. It is overflow incontinence.
Right.
Okay. So incontinence is basically leaking urine.
Yes. Ankur Prakash has a similar question, doctor. He's asking, sir, if someone is leaking urine during laughing and sneezing, does this belongs to OAB?
No. Just I covered that part only. It is stress urinary incontinence. The in OAB it is the urgency urinary incontinence. Both are different. Stress is just coughing, sneezing, and the urgency is we are having a strong urge to pass the urine. In stress incontinence, there is no urge legs as such.
Right. Mohammed Shahrukh is asking, does the medication have any side effects?
There are two groups of medicines which are widely used nowadays. One is antimuscarinics, one are beta-3 agonists. So the antimuscarinics which were used initially had some side effects, but right now the latest one which are there which have very less side effects. And the side effects which are there are dry mouth and constipation can occur, but these are also very less nowadays with the latest medications.
Right. And I'm sure, Mohammed Shahrukh, if you go and consult with your doctor, urologist in this case, they'll actually help you and guide you about the medicine and the potential side effects, and they'll also tell you how to, manage that. So please don't panic just because the medication will have some side effects. You'll just keep on suffering, and don't do that.
Mostly the patients are treated by just lifestyle modifications only if needed. Medicine are very few side effects.
Right. So it's important to go and meet the doctor. We have Radha Krishnan asking, are there other lifestyle steps to take in order to manage OAB? And doctor, along with this question, I have one more question. And the question is that, can I prevent OAB? Like, I don't have the symptoms right now, but maybe after a certain age, I'm, assuming that I'll have these symptoms, because normally after a certain age, people have these symptoms. Can I prevent these symptoms by doing the lifestyle modification thing?
Just we need to maintain a healthy lifestyle, healthy diet, healthy routine, going for a morning walk, doing some yoga, doing the pelvic exercises are also there in yoga also, which have strengthened the muscle. We're going for a regular gym, regular yoga, a healthy life. Then these things are preventable.
Exactly. So maintaining a good, healthy lifestyle is what you need to prevent, or even if you have OAB, then they'll actually
sure. Yes.
Great. Yes. We have Ayush Soni. He's asking, are there dietary habits which help in preventing OAB? Though we have already discussed it, but still, would you like to throw some more light on that?
Basically, abolishing the caffeine intake. If you have symptoms, don't take any caffeinated products like tea, coffee, or any beverages. Limit the amount of fluid intake which we are taking. Mainly, these two things are there in the diet, and also along with that, the spicy foods and the citrus fruits. We may need to just have it in limited amount, not much.
Okay. Now, doctor, when you say citrus fruit, in India, we have this tendency of getting up in the morning and drink a lot of water. Again, no calculation or no limit to that water, and a lot of nimbu pani or lemon water as well. And we always have this fun that will actually clean up all the toxins from the body. So is it the other way around when we talk about the symptoms, or when we talk of OAB?
Basically, a simple English saying is there, everything in excess is bad.
True.
So we have to limit it. And also the water, the way which we take, we will take 2-3 glasses of water immediately after waking up in the morning. Then for 4 hours, we will not take any water. It is wrong. We should take water throughout the day. Like if you have seen some patient in the hospital, the IV fluid is going on. It is going at a particular rate. Not like that they will rush 1 liter fluid and then for 10 hours nothing. It is not like that.
True.
It is going continuously. Like that, we have to do the fluid intake which we are taking. Not any excess amount of fluid at the same point of time, but a smaller amount of time and number of times a day. Which we can keep a bottle on our desk, keep on drinking, sip 1 or 2 sips every 15-20 minutes, like that.
Right. So yeah, very well said, that excess of everything and anything is bad. So don't overdo it. We have Niranjan Reddy again. His question is on the same lines. Daily having 4 to 5 cups of coffee, is it going to cause OAB?
Basically, it is one of the factor. Caffeine is one of the factor which leads to the overactivity of the bladder, because of which diuresis action. And if the one is having its increased frequency and urgency, he needs to stop the caffeine intake. But at the same time, if he is not having symptoms, but will caffeine cause later on, this is not a non-factor. It can affect the nerves. Like I said in the pathology, some neural mechanism is there, myogenic mechanism is there. It can act as a toxin product on the urothelium of the mucosa. So avoiding caffeine and taking more of a green tea will help.
Right.
We can switch from caffeine to green tea.
Right. So always better to switch to some healthy options, right? Which is widely available these days. So don't risk with your health. We have Sebastian R asking, is OAB fully treatable in old patients?
It depends on the symptomatology, age profile of the patient, how much damage it has done to the underlying organs, and how early is the presentation of the patient. It all depends on these things. If the patient has presented early, underlying bladder and kidneys are normal, it is treatable.
That's why we are continuously saying that please don't suffer in silence. Don't waste your time now. At least you know that there is a term called OAB. So please come up, talk about it, go and see your doctor. The early, the better. And your quality of life and health is going to, actually hamper your quality of life. And doctor, what are the most commonly committed mistakes by the patients of OAB? I can understand, that not showing up to the doctor is definitely going to be one. But are there other things that they end up doing, and when by the time they reach you, you are like, you should come early, or you should not have done these things?
Like what the patients do, they will consult some neighbors or some just a chemist. They will say drink more water and you will be okay. But they suffer more. It just supervenes the symptoms which the patients are having. They just take some medicine, non-specific medicine from a local practitioner, also from some pharmacy only, which can later on hamper. So just taking the advice from the layman's, taking some the medicines without any prescription, will ultimately hamper. It will not solve the issue. So a common saying is there, almost every urology patient, अक्सर पानी बहुत ज़्यादा पीते हैं फिर भी ठीक नहीं हो रहे. But this ultimately aggravates the problem.
Right.
There is a particular amount of water which needs to be taken, not too much amount of water. That is a most simple myth which the patients are having, for which awareness is needed.
Right. And doctor, as we are moving towards the conclusion part of this session, any takeaway message for our viewers?
Takeaway message is just to have a healthy lifestyle. If there is any problem, consult a specialist. Mainly, there is no need to suffer. There is a treatment for everything with these simple remedies. There is no need to be afraid of, no need of any social stigma. Just consult a specialist if you are having any issue.
Right. The bottom line is go and consult a specialist. The irony is that we will go to the chemist and go for an over-the-counter medication. We'll go and follow the prescription that our friend or any known person were following. but we won't take out the time to actually go and show to the doctor, which is
Yeah.
actually important, So don't waste your time surfing online. Don't waste your time and money and energy on over the counter or self medication. Please go and consult your doctor. That's really important. Otherwise, you're
Yeah.
actually causing more harm to yourself. Don't do
Yeah.
that.
Yeah.
So thank you so very much, Dr. Charan Kanwal Singh.
Yeah.
It was a
Thank
pleasure
you.
having you, and thank you for your valuable time.
Yeah. Thank you so much. So, thank
And
you.
we indeed have a very informative session with you, sir. We really look forward for many more such sessions in coming times.
Yeah. Sure. Thank you so much. Thank you.
And thank you, viewers, for an excellent participation and for more information on how to diagnose, manage, and treat overactive bladder. You have all the informations on our every page bladder wellness. So stay connected on our every page bladder wellness. We are also available on YouTube, Twitter, and Insta. Thank you.